Compassion and Caring Through Loss, presented by Melissa Juarez and
Isaiah Carlson. Caring through loss. Therapeutic practices can support both patients and nurses' well-being. For example, encouraging memory recall through photos, music, or storytelling helps maintain identity and emotional connections. Nurses often navigate both patient care and personal coping with grief by building meaningful connections and emotional satisfaction from sharing moments when the nurses connect. Alzheimer's disease presents complex emotional and clinical challenges, which is why having a care plan helps memory and coping skills.
Purpose: to provide evidence-based guidelines that support nurses in delivering compassionate therapeutic care to Alzheimer's patients while managing an emotional impact on death and dying.
Our scope. Focus on nurses working with Alzheimer's or dementia patients, therapeutic interventions for patients and coping strategies for nurses. Include guidance for end-of-life communication, comfort care, bereavement support, applies to acute, long-term care, and community care settings, length of clinical work experience, and incidence of healthcare associated with infections.
Understanding Alzheimer's and hospice. Progressive neurological disease affecting memory, cognition, and behavior, creative skills, and responsibility can embody safety, routine, emotional reassurance, and show the importance of individualized care plans and family education.
Therapeutic interventions. Use of routine therapy, music therapy, validation therapy, and objects to help with motor skills can promote dignity and person-centered care. These therapeutic exercises can encourage family involvement to ensure patient comfort. This is an informative daily task to use while working in occupational therapy.
Dealing with death and dying. Recognizing signs of approaching end of life, providing comfort measures and emotional presence, supporting family members through loss, and maintaining professionalism with sympathy and empathy through the grieving process.
Self-care. Emotional assessment and self-reflection using therapeutic communication, use of debriefing, peer support, and professional counseling and support groups. Balancing empathy with self-preservation, encourage breathing exercise to decrease anxiety, support healing, and overall well-being.
Ethical and professional considerations. Upholding patient dignity and independence during personal care, respecting choices and supporting mobility, navigating complex family dynamics and ethical dilemmas by supporting a safe place and communication, and maintaining professional boundaries, following intuitional protocols for palliative and end-of-life care.
Summary. Alzheimer's care requires patience, empathy, and clinical skill. Therapeutic techniques improve quality of life for patients. Nurses must also care for themselves as they care for others.
Takeaways. People may explore compassion and caring for context of loss. They often come away with a deeper understanding of emotional and human experience of great loss. They learn that compassion involves being patient, listening without judgment, and offering comfort in ways that respect each person's unique grieving process. Discussion on loss highlight the importance of empathy, patience, and creating safe spaces for individuals feel seen and supported. People also recognize that caring for others through loss requires self-awareness and boundaries, reminding us that supporting other beings with nurturing or our own emotional well-being. Overall, these conversations emphasize that compassion is not about fixing grief, but about honoring it and showing up with kindness, understanding, and genuine connections.
That's it. Here's our references.